This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
I want to turn it over to Marianjoy, our first team presenting of the evening. Thank you all so much for being here.
Hey everyone, this is Haris speaking, Haris Arshad, one of the PGY3s at Marianjoy. Along with me, I have...
Hi guys, my name is Monis. I'm a PGY4, also at Marianjoy. Glad to be here. Thank you for having us. We also have our APD, Dr. Anita Ko, and our program director or program manager, Dr. Yana Pano. She's also here if there's any relatable questions specifically to them.
I'm going to go ahead and start with our presentation. I'll share my screen in a little bit. Okay. Can everyone see that okay?
Yeah, that's great.
Okay. All right. So Northwestern Medicine, Marianjoy Rehabilitation Hospital. So we're located in Wheaton, Illinois. It's a suburb that's about 30 minutes west of Chicago. Very easy access to get to Chicago. Very nice, pretty suburb. The hospital itself has been around for some time, but it was recently bought out by Northwestern Medicine about, maybe 6 years ago or so, something like that. Ever since then, so we do have that Northwestern Medicine affiliation. Why Marianjoy? Like I said, we're located in the western suburbs of Chicago. We are a freestanding single-site rehabilitation hospital, approximately 120 beds. There are 6 different units in our hospital: the stroke rehabilitation unit, brain injury, general/neuromuscular, the ortho floor, pediatrics, and I think I'm missing one. I think those are the main ones. Spinal cord, of course, spinal cord injury. So we have, all those different units, and approximately 120 beds. We do have some capabilities on site, like X-ray and capability of doing IV medications, etc. But certain things that we don't have a CT scanner. We do have codes and rapids, just like an acute care hospital, and that's all resident run, which is good because we're given a lot of autonomy. And in certain cases, when it goes beyond our capacity or capabilities, we do have to transfer to an acute care hospital. The nice thing is we do have a pretty good relationship with Central DuPage Hospital, which is also a Northwestern Medicine hospital, and we can facilitate transfers to there, which is just a 10-minute ride pretty easily, if we need to. We have a dedicated programmatic approach to patient care. We have we have multiple faculty members that are relatively, I would say, within 5 to 7 years graduated recently, so they have all the up-to-date practices. They're very open, easy to reach out to. 75% of our rotations are on campus, which is great. And then we do have the opportunity to go to off-campus rotations, such as Hines VA, Lovell VA, and some other locations. But overall, it's nice to have a majority of the rotations at home at Marianjoy and then get a little bit of a mix elsewhere. Another great thing is we get one-on-one with all the attendings. There's very, very few times where you work with a senior resident. It's usually just you and the resident most of the time. Oftentimes we will have medical students, which is great because you get to learn from the attending and then teach the medical students. So kind of the best of both worlds. And then, one of the biggest things, it's an unopposed program, so we don't have any fellows. So for all procedures, we're first assist. A lot of faculty members, really give us a lot of autonomy and leeway and free ability to kind of learn these procedures. So we get a lot of time to do that. So I think that's really unique. And then, we get to observe, learn, and practice different styles and techniques. Every provider is a little bit different. And then just PM&R, there's so many different practice models. And I think Marianjoy kind of really gives you a different taste of all the different practice models by the time you're done, which is really important to have. Last thing is, a very important part of our system is that we have Epic. I think that's huge for anyone who's used any other EMR besides Epic, knowing that Epic is very important part of our system. Other unique things that we have that other programs don't have are the unique technology that we have. We have in the outpatient setting, and sometimes using the inpatient, we have robotic machines like our Mayo, our Medeo, Exo machine, Zero G, DVR video goggles, New Step, all these different types of technologies that really help. Our residency is very busy at some points. So I think it just gives us a lot of exposure to a lot of different things. It can be very PGY2 is very inpatient heavy. So I think it prepares us to see a lot of patients if inpatient is a route that we decide to go to. And then third and fourth year, we get a ton of exposure to EMGs and different procedures, interventional spine. We just recently added a sports medicine rotation. So I think, we have a very wide variety of things that we do. And then, we are an advanced program, so we only offer PGY 2, 3, and 4, and 6 residents per class, 18 total. And overall, we like to think of ourselves very team-based. It's not a huge group, 18 residents, very small. We all have our didactics, like most of the time our didactics are together. Most of the residents are together on Thursday morning. So we have a lot of time to hang out, get to know each other. We have a basketball team. We do a lot of things together. I just played basketball this morning with Mona. So, we have a good time. It's a really fun program. The faculty members, like I mentioned, they're all, relatively young. So we have a good time with them too. There's a lot of culture within this program. So, if you're looking to work hard but play hard, Marianjoy is a good place to come. So I'm going to hand it over to Monis to continue.
Thank you. In case anyone was wondering, we lost that game, but there's always next week. So we'll try again. So one of the most important questions that med students usually have about fellowship or residency programs is where we end up after residency. So this is a list. I think it's in chronological order. So the most recent is downward. So the last 6 fellowship matches on the bottom of this list are our class that graduated this past year in June. For the most part, I think most of our residents end up doing fellowships and we match very well, kind of go all over the place. And there's a good variety of the type of fellowship that we're going into. I think our current PGY4 class, there's also all 6 of us are going to be applying into fellowship. But, I think we do a great job of preparing even those who are not interested in fellowship. So for instance, when I was a PGY2, Dr. Coley was a alumni who had just graduated. She was going to be moving to Florida, I think in January, to start an inpatient rehab job. And so she spent 6 months kind of moonlighting or just doing locums at Marianjoy as an attending. And she worked with some of the residents and, she was already functioning at the attending level. So I think it really speaks to kind of the experience that we get on the inpatient side of things, not to mention all of the exposure we get as outpatient residents to kind of get exposure to all the different types of procedures that are available that then translate well into fellowships like pain or sports and whatnot. Can you go to the next slide, please? So benefits, something that I did not even consider when I was a med student, but once you become a resident, I think you realize how important they are. One of the biggest benefits of being a Marianjoy resident is that your health insurance is paid for not just for yourself, but also for your family. So that's spouse and children. As a father, it's a big deal. It's a huge burden lifted. It doesn't come out of your paycheck. It's an extra benefit. Um, we get discounts to Bulls games, White Sox games, Blackhawks games, different restaurants in the area, in the city and in the suburbs. And then there's all types of different promotions for hotels and car rentals, all kind of through that Northwestern affiliation. There is an annual wellness fund um, that goes into effect at the beginning of every year. So you get $250 that you can spend on any sort of fitness related product, but that's pretty like flexible of a category. So AirPods, Apple Watches, they all kind of fit in there. Conference days, kind of pretty standard. So last year I was able to attend 2 conferences. One was AAPM&R, another one was a pain-related conference, and all of it was reimbursed by the program. You do have to be a first author, so you have to be presenting something, but for a lot of these conferences, there's plenty of research opportunities available within the program for everyone to be able to at least attend one conference, typically per year. We also get financial support when it comes to board review as 4th years. So we will be going later this year. I believe it's in Seattle, where all 6 residents will have the opportunity to go over there for a week or 2 and go over board review. A couple months ago, we also attended a week-long P&O lecture series that will also be helpful when it comes time for board studying. That was completely funded by the program, and it was in the city, so it was a nice kind of change of pace for the PGY3 residents at the time. You get a $175 stipend for books as your PGY3 year and PGY4 year, and that doesn't include the books that you receive as a PGY2 when you first start. So I think everyone gets a copy of Bradham and Cucarulla. So more than enough to cover all the resources that you'll need studying for boards during residency. And then the great support from the program, from the director, the attendings, APD, all the residents, fellows. Basically, residency 3 to 4 years is going to be a very volatile time in people's lives. A lot of things happen in just our class of 6 residents. We've had 3 children and 1 marriage in the span of about 2 years. And so it's very nice that our program is extremely flexible. I think wellness is not just something we talk about, it's actually something we partake in and allow all our co-residents to have that opportunity to experience those parts in our lives without it being very difficult or an inconvenience on the program. And then obviously you get to live in an incredible city for 3 years. So not too far from the city. A lot of our co-residents live in the city, and it's not too bad of a commute in and out of Marianjoy. And those who have families will live, a little bit farther out in the suburbs, but plenty of opportunities for everyone. But most important, if you go to the next slide, I think our biggest strength is the people. So I think there are really strong relationships that you build with your co-residents, with your attendings, and with the rest of the staff at Marianjoy while you're here. I think we are all very close. Like Horace kind of mentioned, we do a lot of things outside of work. It's a pretty regular thing. A lot of the co-residents are from out of state. And so, we kind of become each other's, social circle and kind of family and are each other's close friends. So we're very involved in each other's lives. And it's been a really great experience so far. So these are some of the contact points that you can reach out to if you do have any further questions. Horace and I will also drop our emails if you have any specific questions for one of us. You have our program director, Dr. Pavone, our APD, Dr. Ko, who's also here on this Zoom meeting now. If you have any specific questions for her, as is Yana, our program manager, and then Burke and Haley are our 2 chiefs for this year. Feel free to reach out to any of them. But yeah, anyone have any questions or anything we can help answer at this time?
Just a piggyback while we have more time. last thing Monis was saying is PM&R in general is very like laid back field, and it's really nice. People are very friendly, but especially in our program, we have our entire PGY2, we all work in the same space, in the same workroom, so we get to know each other really well. I think that's a privilege that not every program has, and it's important to ask about who you're working with and where you're working with. So even though it's one-on-one with attendings, we sit with our co-residents like throughout the whole year. Just to go through some of the questions. I guess I'll O and P, like I guess P and O. So besides the P&O lecture series, you have clinical P&O experiences. Yes. So during your 4th year, there is a P&O rotation, dedicated P&O rotation. That's 2 weeks. And also we have a Marianjoy outpatient rotation during your 4th year that's separate, that you can go down and learn P&O. And really, like, there's a lot of flexibility. If there's something that you're passionate about and you want to learn more, you can always go down to the clinic and observe and work with our P&O specialist and the physician that runs the P&O clinic on that day.
Yeah, we have 2 pediatric fellowship trained physicians, one of them being our program director, Dr. Pavone. So they do a lot of P&O in their pediatric clinic, and we have a 2-month peds rotation. So you'll see a lot of P&O on that rotation as well.
And just a heads up that you guys have 5 minutes remaining.
What does your program look for in applicants prior to interview selection? I think we look for well-rounded medical students who are really truly interested in PM&R. PM&R is a very kind of versatile field. There's a lot of different things you can do with residency in PM&R. So it can be many different ways that you might be interested in the field. So we're kind of looking for those students who are well-rounded and who have a genuine interest in some sort of subset within the field.
How are the electives structured? Do you get to choose electives in the fields you are interested in, and is there a lot of flexibility in these choices? Yeah, so actually we made a little bit of a change recently. So we moved the elective to our 3rd year. It was originally in our 4th year, but it isn't during our 3rd year now. It's a 2-month elective block, and there is quite a bit of flexibility. It's really whatever you want to make out of it. There's opportunities for sports medicine, opportunities for research, opportunities for doing other inpatient rotations. Residents have done radiology, either in neuro radiology or MSK radiology in the past. It's something that you just have to work towards a little bit earlier on to know what kind of want to do. But residents have done all sorts of different types of things with the elective. So there's some precedent that's already set, which makes things a little easier.
And just to add on to that, the electives used to be a 2-month period as 4th years, but it was kind of a resident-driven change. We asked for it to be sooner so that we'd have earlier exposure to things that we were maybe considering going into, and didn't want to wait until PGY 4 year. And that was something that the program was very receptive to and was able to change for us.
And hi guys, it's Anita Co. I'll just add on to that. I think Horace kind of mentioned that there's like an inpatient elective as well. That's opportunity, and just to kind of expand on that, I think it's something we brought new this year based on feedback, and it's really great for residents who are looking to perhaps enter a fellowship where they want to do a little bit more kind of at the end of their PGY4 kind of that's where I'm looking for, kind of just practice again. Like if they want to go into a fellowship that is TBI or SCI or just like general rehab, when they come out and not do a fellowship, is a great inpatient elective where they actually come back as a 4th year and are kind of like basically an attending, kind of running the unit with the PGY2 and under the supervision of the main attending. So I think it's great for you guys to feel even like more prepared as a 4th year. So that's something new that we brought as well.
With regards to IMGs, I honestly, I don't know off the top of my head, but I don't think currently we have any. I know one of our chiefs a couple of years ago was a graduate of a Caribbean school. But yeah, I currently I don't know if we have any. I'm not sure. I don't think so though. Being within the
We all have
Northwest.
about 1 more minute.
Oh, thanks. Being within the Northwestern system, are there opportunities for residents to pursue public or global health experiences during residency? I wonder if Yana would know this. Obviously, public health experiences, sure, like Northwestern Medicine is a huge, organization, corporation. Like there's, there's opportunities for volunteership and, giving back to the community in a number of different ways with Team NM. I'm not quite sure about the global health experiences, but I don't know if Yana knows maybe. If not, we can get back to you if you just reach out to us through email. I can get back to you on that.
I'm sorry, can you hear me now?
Yeah, we can hear you, Anna.
Okay, I'm sorry. I was I was trying to unmute there. So yes, what Hara said is accurate, and so we're always looking for opportunities that align with what residents have interest in. And if somebody had something specific, we would look within the system to see what was available. So thank you for the question.